So I want to welcome everyone to our monthly webinar for weight loss surgery in Mexico. We are pretty much set every first Saturday of every week to have this webinar on a regular basis. And if we do have any changes, you can always check on our website to see what is the next upcoming date is. But I like to continue here. We have pleasure to have Dr. Valenzuela join us from Tijuana, Mexico. Thank you for taking time to join us, Dr. Valenzuela.
Hi.
Hello, good morning.
Good morning.
So I just want to make sure everyone who is attending has already submitted an HQ. And if you have submitted your HQ before and you qualify for the procedures Dr. Valenzuela offers, we can switch you. You don't have to submit another one. But if you haven't, please select Dr. Valenzuela as a surgeon of your choice and submit your HQ by going to mexicobariatriccenter.com/health-questionnaire. And we like to have you to the end of the webinar so you can qualify for a raffle of $2,000 off of your surgery package. We would do this at the end of the presentation, after we do the question and answer session. So we're trying to cover as many frequently asked questions in our presentation. So please pay attention so we don't have to repeat the same answer. And if not, if you didn't hear your answer to your questions, at the end of the presentation, you can enter it in the Q&A tab, and we would try to cover as many as our time allows to cover these questions. The topics that we are covering today is basically what is obesity. I bet everyone that we are, attending this webinar pretty much know. Risks of being obese, weight loss surgery. We talk about MVC, Mexico Bariatric Center, and what is it that we're doing. And Dr. Valenzuela take over at that time, and she would talk about bariatric surgery, basically all the laparoscopic and endoscopic procedures that we offer, and go over all the options. We talk about our specific bariatric vitamins made for bariatric patients. And then at the end, we will have Q&A answer session, and we do the raffle. Well, obesity is a chronic disease, and it's a metabolic disease. And it's proven that it is a disease. And basically having access to the high calorie food, sugary drinks, human body is not used to all that we have access to. And physical activity is becoming less and less, and human body is not used to sitting down all day and not having be active and be out in the nature. So that's why we don't have any defense mechanism against what we are exposed to, and obesity becomes even a bigger problem as it is becoming a bigger problem. Of course, our genetics is a huge factor, the environment that we are exposed to, and how developmental history of each of us, stress, eating, lack of sleep, the weight gaining drugs, all these are contributing to this problem. In the medical arena, basically, they have a formula which they call BMI, which is body mass index. And basically, it's a very simple formula where you put your height and weight and you come up with a number, and that number determines where you land in this chart. Anything below 25 is considered normal, 25 to 30 is overweight, and above that is called obese. And then there is a degree to obesity of morbidly obese, super morbidly obese, super morbidly obese, and it goes on and on. And one thing that we're going to see later on in our presentation is that we are not limited to what kind of a BMI you guys have. So we can go all the way to 100 BMI and do the surgery. So there is no limitation of what we can handle in our center. So one thing that is interesting about fat tissues, or what is called adipose tissues, are that when we gain weight, not only they increase in numbers, they change structure too. As you see on the right of the screen, how an obese adipose tissue is different from a lean adipose tissue on the bottom of the picture on my right side. And that structural changes is responsible for us not being sensitive to insulin and leptin and therapies and even vaccination. And we don't respond well. So not only the adipose tissues increase in numbers, they also change their functions. As we all know, obesity is a major risk factor, especially during COVID. We found out how bad it is, and how bad we need to change our behavior, lifestyle, and diet and exercise. And obesity became a problem. It's already a problem. 40% of adults in the US are impacted. And I like to show always this animation of what happens when we gain weight and we gain fat and we store fat in our abdominal areas. Of course, as we said, there are numerous issues that come with obesity: heart disease, cardiovascular disease, stroke, diabetes type 2. Diabetes type 2 is a huge issue in US and of course everywhere else now. And lung disease, among all the other ones that we experience. Chronic inflammation, blood clots. And again, during COVID, because COVID viruses attach itself to the protein and fat cells, and they have more places to attach when we have more fat cells, of course. And that's why people are more prone to end up in the ICU and die from COVID. So this has been a hot topic of how do we get over obesity and being overweight. The first thing, classical diet and exercise. A healthy diet can contribute 80%, and exercise can contribute 20% of the weight that you can use, but you can lose. But the problem is not a long-term solution. We're going to see why it's not a long-term solution. Of course, exercise is essential. We have to always do exercise regardless. But to cure obesity, obesity is a complex disease and is a hard disease to cure. And now we go to the pharmaceuticals, which is the drugs, the pills that they always had problems with, that would mess with your brain and all that issues that we experience. And now we have these injectables, which is mainly known as Ozempic, Mounjaro, Wegovy, and a bunch of those class of drugs that has actually picked up. And actually Ozempic is being used off-label because there is a shortage, and they're giving away Ozempic like candy now. It has gone up 300% since is prescribed 300% more since 2020. But we don't know what the long-term effects of these are, or the side effects or risks are. And is also, again, is not a proven long-term solution to cure obesity. As we will see, bariatric surgery, it's the only way to quickly and safely to reduce weight and keep it long-term. Let's say the injectables, you have to keep using the injectables, and then the minute you stop, you're going to gain the weight back. So, and also now that we have all these different options, obesity could be cured by a combination of these. We will see how like the endoscopic procedures are not as invasive as laparoscopic, but maybe it can be combined with diet, exercise, and some injectables, and basically everyone would find what's the best option for them. We have several articles that we went over. What are the dangers of using Ozempic for people who are non-diabetic? But the problem with diet and exercise is when you go on diet and exercise, well, let's say you go on diet actually, your metabolism is decreased, your hunger is increased, and your satiety goes down. And that's why it's hard to achieve your goal weight and keep it for a long time. As I said, obesity is a metabolic disease, and bariatric and metabolic surgery is actually resetting your metabolic system. And how it does is by changing your hormones, your interaction between the hormones and your brain changes. And that's why you lose weight and you keep it off. And it's a natural way to lose weight because you change the hormones once forever and stays that way. And we call it a gut hormone interaction, or we call it metabolic thermostat or metabolic system or brain thermostat. These are all referring to the same concept, that your brain and your hormones are at a certain level. And when you do the bariatric surgery, you basically change this interaction and you lower it. That's why you don't get as hungry and your metabolism goes up. So the figure on my right side shows the difference between person who has lost weight 75 pounds by diet and exercise and a person who went through bariatric surgery and lost 75 pounds. The person with the diet and exercise, which is the person in yellow, experiences increased hunger and lower metabolism, which is resisting against losing weight. The minute you wake up from bariatric operation, your brain is going to see you at lower thermostat, lower metabolic system thermostat. And that is why you don't get as hungry and your metabolism goes up. So now the question is, if you don't have your insurance cover for bariatric surgery and is pretty pricey in United States, Canada, a lot of places. And so what are my options? If my insurance doesn't cover or it covers, but it's very hard to meet the requirements they have, and also the out-of-pocket expenses are more, maybe twice as much as you would pay for an all-inclusive package going to Mexico with us. So that's when we come and medical tourism comes into picture. One thing about medical tourism is that medical travelers need to hook up with a company who does all the arrangement for your pickup, your hotel, for taking you to the doctor's office, and preferably offer medical tourism insurance. So you're covered. So the logistics is important. And if you even look at what CDC recommends, is you need to work with a medical tourism facilitator like NBC. NBC, since inception, has been about providing people who are uninsured or underinsured with quality medical care in Tijuana, Mexico, and Guadalajara now. One thing you may want to do when you're researching for which company to go with is to understand the pitfall of social media. Anybody can put some before after pictures and post something on Facebook and TikTok and make it interesting and may post Instagram pictures or content or videos to be attractive, but you don't know what is behind these marketing strategies. Is there a real company behind this? Is this a trusted organization, or they just making this place or this doctor to look good, and they don't have the capacity or the experience or the skills that you need to be going to abroad basically and getting surgery and come back safely. Mexico Bariatric Center was created in 2012. We are a US-based corporation in California with our main office in Sacramento. Of course, we have people all over US and Mexico working with us, but that's our main office. And our mission has been since inception to provide quality weight loss procedures in Mexico. And we have tried, and we're still trying so hard with all the inflation, all the changes in the value of dollar to pesos, to provide the most affordable prices that you can find for the quality of service you get. So if you ask me why NBC, These are the items that makes us different and makes us to be one of the top providers of this procedure in Tijuana. And we are highly regarded by patients, our past patients, the industry leaders, the medical community in Mexico. We are highly regarded as one of the top uh, offering these services. So, I can pretty much touch on some of these items, like our reputation. Like I said, our reviews out there were not like just a website and a marketing firm. We have infrastructure. We have a medical doctor reviewing in US every HQ that is submitted. We are a BBB member and A plus rated in a BBB. We are certified by Medical Tourism Association. Our scheduling process is very easy. You submit the HQ. You can actually book yourself after you get the approval from the surgeon online. Pick a date, pick your surgeon, pay the deposit, and you be contacted by our staff, our coordinators, to set you up for the rest of the paperwork and all that. We've been doing seminars from, maybe 8 years ago. We've gone to all over US and Canada. And after COVID, we pretty much started doing the webinars because of COVID. And also, it's probably more friendly to people's schedule and timing. But we're still open to do more seminars in Texas, Washington, Atlanta, Georgia. So, of course, I will go over our surgeon qualifications later on, and that's another factor that makes us top-notch provider in effort to keep continuing providing high-quality services. Hospital Azar has been a project since we've been following since 2011, and hopefully by end of the year we'll be able to operate in this highly sophisticated, state-of-the-art facilities. And basically, these are some of the pictures that is in construction right now. Dr. Valenzuela, this is an early on picture that we took with Dr. V when we were visiting at the very early stages of the construction when they were framing. So why MBC? MBC has been in business over 10 years. We have performed 20,000 plus surgeries, safe and with high outcome. We work with 7 top quality bariatric surgeons in Mexico. Our packages are all-inclusive, which means you get in your package standard medication, hospital nights, hotel nights, surgeon fees, transportation, nutrition support, aftercare support. All that is included. And we're not cutting short any of our services that we provide. Again, our process to get on the calendar to go get surgery is very simple. You fill out the HQ, you get your approval, You pay the deposit, find a date that works for you, and the surgeon is available. You book your flights, and or you driving. Either way, you finish your paperwork, you're on your way. We highly recommend you have passport. It will be either a passport card or a passport book. It's easier to cross the border without any interruption. Uh, Anytime you do any weight loss surgery, you really need to have support before and after. That's why we have of course, it's our main public Mexico Bariatric Center, MBC, Facebook. We have what we call inside, where we have the patients who are on the fence. And then once you have your surgery done, you can join our main support group, which is more than 10,000 patients. Our affiliates, or which is our past patients, are there to help you. I think Dawn is, I saw her at the beginning of the presentation. She joined us today. And Sarita has been with us for, gosh, at least 8 years. Rena, which is a great, these are all great assets to company and to patients. They are around to help keep, hold your hand and show you how to get to where they got. And Kelly, Elizabeth, so we have all these people that are helping us, supporting patients. They actually, Rena and Sarita, do a podcast that are, I recommend you join. It's great information. So basically, once you fly or drive to San Diego Airport, you are basically being taken care of all the way to the time that we drop you back up to San Diego International Airport. We like you to come before 12 p.m. and leave after 2 p.m. That gives us enough time to do your pre-ops when you arrive, and it will give us enough time to get you across the border to US to your flight. For people who joined later, I want to make sure you all have submitted the HQ either today or before, and you select Dr. Valenzuela and watch the webinar. That's a requirement to be included in our raffle to watch the webinar to the end. And we would draw a lucky person's name. Of course, you guys are lucky to look at this option to lose weight and change your life and basically take control of your life. But that person would get $2,000 off of surgery package. These are for the procedures that Dr. V offers, of course. Now we're talking about network of the best bariatric surgeons in Mexico. And I'll have to mention something here that these surgeons are prestigious surgeons, and they're viewed highly among their community, and they are being watched from all over the world, from different countries. They come from Peru. Different countries come to just watch these surgeons do their surgery and learn what is it that they do, to learn their technique, their experience. We work with 7 of these doctors: Dr. Miguel Montalvo, Dr. Louisiana Valenzuela, which is we have a pleasure to have with us today, Alejandro Gutierrez, Rodriguez Lopez, Jacqueline Osuna. She works in Tijuana as well as Guadalajara, Mexico, and Dr. Jesus Ceja. We were mentioning about our surgeon liaison, and it's a doctor bilingual sitting between the patient and the surgeons to review every HQ comes in. Of course, you still have your nutritionist, your patient coordinator that is responsible for your case and follow your case all the way, but that's what makes us different from other companies. Our pre-op diet is very simple. It's based on the BMI, and it goes from anything from 2-day clear liquid to 8 weeks if your BMI is really high. This is something you need to do as good as you can to help yourself and your surgeon during the surgery. This would be much easier when you do a good job on your pre-op. The surgeon, it will be easier for surgeon, it will be easier for you to recover faster. So this is something that you need to commit to and do a good job. Um, of course, our surgical center is dedicated to only doing bariatrics, and we've been doing this for so long. That's why we have such a good success. We use for a hotel, we use Hyatt Place. It's a really nice place to be. Um, they provide uh, broth, popsicles, ice, and you enjoy your first night stay when you arrive to be ready for the next day to go through the operation. Um, just relax, get a good night's sleep, and be ready at the time that they ask you to be ready in the um, lobby of the hotel. And your companion can stay with you the first night in hotel, and they stay when you go to the hospital. They enjoy a free breakfast. And once you're in the hospital, they can come and visit you, of course. Um, on the day of the surgery, just try to get up as soon as you can, walk around, and be active. Um, After the surgery, you be taken back to US to fly back or drive back home. We do our post-op tests, of course, multiple leak tests, amazing patient care, and you're ready to go back home to start your journey. Why MBC? Another point of making us different is our surgeons' load management. We cap our surgeons' load per day, and we manage their load during the week and make sure every day they're doing enough but not too much surgeries for your safety. And that's why our complication rates are less than 1%. This is really a great statistics to have when you know that in general the complication is up to 2.8%. So Dr. Valenzuela is one of the first surgeons that joined MVC, and so she's had more than 10 years with us. She is, I can't say enough of how great this surgeon is. And of course, she's not only as general surgeon certified, she's a bariatric surgeon certified. So she's double board certified. Her training, her experience, her skills makes her be one of the most wanted surgeons we have. And right now I'm going to let her take over and talk about herself as if she wishes, and also talk about other procedures that we offer in our center. Dr. Valenzuela?
Hello, it's
Hi.
good. The audio?
Hello.
It's good the audio from?
Okay, so do you see my screen?
I can see it.
Okay, so let me go back. There you go. Oh.
Hello, everyone. Today we will try to give you answers about your questions in the bariatrics. You can start with the questions to try to respond all the questions you have about the surgery, of course. We are doing a lives in the Facebook, Instagram, every week, more or less. So if you have more questions after this seminar, you can join us the next, maybe the next live. So we are different options in the surgeries, and it depends of every one of the patients what it will be the ideal surgery for every patient, because it's not the same if you are 30 BMI than if you are 60 BMI or 40, and it's not the same surgery if you have a severe acid reflux or if you have a diabetes, hypertension, sleep apnea, and we will consider everyone issues you have or not to recommend the best option for you. So we have the gastric banding lap band surgery in the bariatric field, but we are not doing more that kind of surgery because we know it's high complication rates with this surgery. So we are now just removing lap bands to convert to other procedures. If you have a lap band surgery before, we can do a revision for you, getting off the lap band and give you the best option in every case. So the gastric sleeve surgery right now in the world is the most popular surgery. It have a very successful rates, and we don't change any anatomy in your body. Just we cut part of the stomach, and then you will have a high restriction when you eat, and that of course help a lot, like a tool to give you this weight loss long term. And the mini gastric bypass surgery, and the bypass surgery is into the field in the malabsorption surgeries, but medium like medium rate of the malabsorption in comparison with the duodenal switch, who is a little more malabsorptive surgery. But the mini and the bypass resolve all the issues with your diabetes, hypertension, high cholesterol, ovarian syndrome, polycyst, and different others problems, health problems you could have. We are having of course, improves in the aborting abdomen. So we in the bariatric world, actually the patients name this new, it's not a new procedure, it's a sleeve surgery, but they named mini sleeve because we are doing just 3 incisions in the patient. So that is a very cosmetic and of course less pain and faster recovery than the regular 5 incision in others in others company and other surgeons. So we are because we have more skills, like Ron says, through all this time doing surgery, we are perfection the technique, and we can do right now the same technique, sleeve surgery, with less incisions. That is better for the patient. Of course, the patients are looking for less pain, faster recovery, and cosmetic. It's a plus. So we are doing this new mini sleeve, but it's the same technique in the stomach. Just the change is the incision in your abdomen. And the single incision, it's another improved technique, but this is just one incision through your belly button, so it's not any scar in your abdomen. So this is cosmetic. This is more for patients who are into the 30 BMI to 35, because we know that patients have more chance to get a small liver, and that is the way we can do just one incision because the liver is small and we can work without any big liver over the stomach. But in case you have a little big liver or hiatal hernia, we need to do 4 incision at the end. Just in that cases, if not, it's 3 incision, or in case you don't want to get scars, if you are in the rate BMI, you can get the single incision gastro sleeve. Remember, the technique, the sleeve surgery is the same for these 3 different options. The scars in your abdomen, that is the difference. And it's repeat, depends of everyone of the liver, if you have hiatal hernia or not, and if you are in the BMI, in the correct BMI to get the single incision, for example. Okay, the duodenal switch, this is a surgery who gives a more malabsorptive approach, and you need to be a disciplined patient to get this kind of surgery, because you need to be under a strict control in your lab test to see your hemoglobin, your calcium, your B12, B6, B1, magnesium, all these vitamin and protein status. You need to be checking all the time to be sure you are getting enough and don't have any malnutrition problem at the end. And well, we can do a revision surgery. Patients who had sleeve and they have a little acid reflux and want to change to convert to bypass, it's possible. And patients who have who has this lab bump previous, we can change to any procedure, sleeve, bypass, mini bypass, duodenal switch. The revisions are possible, the sleeve to any other procedure too. So we are experts in the revision too. We do a lot of revision surgeries. So be comfortable to ask if you want to revision. Could you give me the next one, please? Okay, this like I say the different surgery depends of everyone. Your expectations about the surgery are very important. You need to know how disciplined you are to take this malabsorptive surgery like duodenal switch or a sleeve surgery in case. So the sleeve surgery, like all the surgeries are a tool. The tool the patients needs to know how work with the tool because it's called be with a good function for a long term to get the results long term in your weight loss, or you can break the tool in 3 years. So you need to follow up the nutrition rules to get long-term your tool in a good function. So the sleep surgery is a very good tool. I like a lot the sleep surgery because it's for everyone, just the patients who had this problem with Barrett esophagitis or a lot acid reflux. The best option is the bypass. So gastric sleeve just reduce your capacity and give you the new chance to learn how you eat, how your meals and sizes and portions need to be, and how healthy need to be your food. The bypass, it's a long-term weight loss and resolve the acid reflux, resolve the diabetes. So I like so much that tool, that surgery for patients who had this kind of problem because involve all these chance to be healthy and do this resolution in your comorbidities long term too. The sleeve surgery gives that too, but the bypass is the ideal for that kind of patients because it's a little more long term if you follow the rules. The surgeries and the difference, well, the time in the surgical room is less in the sleeve surgery than bypass. In bypass, we spend a little more time, 1.5 hours, 2 hours, depends of the BMI, depends if has or not this hiatal hernia, and depends of your how big is your liver or not. It's the reason we are asking all the time to the patients to do a very good pre-op diet. Okay, in the bypass, we are doing these two anastomosis. We are do a small pouch in your stomach, and we joined with the small bowel 1.5 meters down to give you this malabsorption in 1.5 meters. You don't have absorption in your food. So we have this free without a sphincter way in the food, and that is the reason we don't have this acid reflux, and you will resolve in case you have acid reflux. And down, if you could see in the image, we join the bellies with the foot down, and then starts the absorption in that part of the intestine, your food. So we need to check, of course, the vitamin, protein, hemoglobin, B12, B6, B1, calcium. to be sure you are absorbing enough with our supplements, and you will be fine with this surgery if you be under your primary doctor checking your levels. Of course, we need to start with protein, vitamins, and everything with all the surgeries when we do the surgery, and immediately after the surgery with the protein, vitamins, biotin. And we need to be sure we are taking the correct doses. So need to check with our nutritionist what doses are you taking, because not all the presentations have the bariatric requirements. Okay. Let me see the next. Well, I try to explain all the different surgeries, but the important here is to answer all your questions. So I see you are having a different questions here. I think if we respond the questions, we can give you a little more information you need. So I don't know, Ron, if we can start with the questions. Do you want I read the questions and answer the questions, or do you want to read?
Sure. You can start answering the ones that are medical, and I do the ones that are more like coordination.
Okay. Well, the first question I can see is one about, is very frequently actually this question, because, and it's very important. I like to ask this because I like to be clarified like this point. The surgery, the sleep, particularly the sleep surgery, in the sleep surgery, we cut the 80% of the stomach. We remove that part and you keep your 20%. In that part, in the top of the stomach, we remove, it's a ghrelin hormone. That this hormone, it's one of the hormones in charge to send signal to the brain to know when we are full and when we stomach is empty. So that is the reason the experts named that hormone the appetite hormone. But it's not just one of the appetite hormones in your body. We have more hormones. The insulin is another, the leptin is another. Different hormones send this signal, depends of the living in your body, and that is depends how your intestine is absorbing the calories, the sugar, and the nutrients you need to perform your activity in your day. And that is the reason it's not completely true that if you do the sleep surgery, you won't have hungry in the future. You will still feel hungry because we can't cut all the hormones. We cut one of the hormones in this surgery, specific in gastric sleeve. And then we have a little help to reduce the hungry, but it's not the unique way to have hungry. So you will continue having hungry because your glucose and your nutrients, your protein, it will be a little low. But the way to resolve, plus the help with the surgery, of course, the ghrelin, it will be off, is to be sure you are having a quality meals, like protein. The protein is very important, and the glucose necessary, carbs necessary. We know that the diet need to be mixed, not just carbs, not just protein. So it is the reason you need to follow up the rules in the with the nutritionist to be sure you are taking enough proteins, enough carbs, and enough vegetables, to be sure your body is not in deficiency of this part of the nutrition condition. So that is the reason that it's a lie if something say for sure you will not have hungry. No, we know helps, but it's not all the way to have hungry. So you need to be sure you are taking enough protein, carbs, but in the correct portion to have this normal level in your absorption, and don't have this starving needs of your body to get this kind of protein. If your hemoglobin is low, you will have more tasty for the meats, for that kind of food. So it's different ways to get hungry, not just the ghrelin, but helps. Okay. Well, the second question is, what precautions are taken before the surgery? Well, the first one is to send your health questionnaire, and we will check what extra precautions you need. The regular precautions in patients who don't have any issue with cardiologies or hypertension or that issues, it's the diet, the pre-op diet, and we will give you some restriction to take blood thinners, and to don't have any procedure 2 months before the surgery, and to stop the beer control pills. And we will give you that precautions. Depends of everyone, of course, and we will check your health questionnaire. For example, if one patient are the age with a little more risk and has hypertension, diabetes, we will ask for a cardiologist clearance, for example, to be sure your heart is enough strong to get the surgery. And well, it depends of the patient. So if you send the health questionnaire, we will see and give you back the special precautions you need. How soon can I return to work?
Okay,
Well,
so I have a slide that I want to show so you can go over that. This is about like recovery that patients ask a lot.
okay. Well, you can see it. This job is 1.5 week, 1 week. The patients who need a little more walking, a little more movement, but not lifting any heavy thing, you can take 2 weeks. 2 or 4 weeks if you are doing a little more constantly movement. But if you need to lift in something heavy, you need to wait 4 to 6 weeks to be ready to return. Okay, so you can see the time here in the screen.
Yeah.
Okay, I have had lateral abdominoplasty. There will be scar tissue. Is that okay? Okay. Well, if you had in the past open incision in your abdomen because you had a laparotomy, you had an issue with your appendix or with your gallbladder, but it was open, we consider that like a open incision fee in that case. But if it was abdominoplastic surgery, we don't consider because it not involved in cavity. It's just the wall. Okay.
So maybe there was another question down here. It says that I have the lap band removed in 2022. Is it still considered a revision to get sleep?
Yes, that is into the abdomen and actually involve our work area with the stomach. And we know, because we did a lot patients like you, we find a lot of scar tissue around the hiatus and in the stomach actually. So we need to clean all that scar tissue, and we spend more time, and of course our skills and experience to do any other surgery. In some cases, the patient has hiatal hernia, and we need to repair in the same procedure. Okay, what symptoms can I expect in the days following the surgery recovery? What post-op symptoms will well, the first day you will feel a little gasping in your shoulders, a little cramps in your stomach, around your stomach, and a little nausea. All the time we will give you medications to try to give you the less issues with the nausea, with the pain, and all these issues. It's part of the surgery in the first hours, but hour by hour it will be less, and some patients don't feel the same than others. Some patients are more symptomatic than others, that it's not possible to prevent what it will be more or less. We use the same preventive medication for everyone. In case you are a little more sensitive for nausea, for pain, we will increase the medications and reinforce the medications to give you, of course, the less symptomatic time. And we push to the patients walk 2 or 3 hours after surgery and keep doing exercise breathing. I always talk with the patients before the surgery and remember this, because it's very important for your recovery time to give you more relief in your gas sensation in your abdomen, and of course prevent clots, prevent collapses in your lungs, who is not common, but because it's preventable. And we do this work with you all the time, pushing you and give you the inspirometer, who is the device to perform the exercise breathing, to prevent any issue after the surgery, and give you blood thinner in the next days to prevent clots too. So we have a very good faster recovery. I can't remember any patients who has any problem with clots, because we start fast. Your oral way, your walking, and your exercise breathing, and that is important. Okay, what is the difference between bypass and mini bypass? In the mini bypass, we just do one anastomosis in the stomach. We do a little more large pouch. You can see in the imagine, in the right imagine, that is the mini bypass. You can see the stomach cutting, but a little more large than the first one, who the pouch is a little more small. It's smaller than the mini. But we do just one anastomosis in the small bowel. So the bilies walk through the small bowel and join in the gastric pouch to continue the way down with the food. And that is the reason the name is a mini, because it's a one anastomosis in your small bowel. But the matters with not absorption in your small bowel is the same or a little more than the regular bypass. In the regular bypass, we cut the first one anastomosis 1.5 meters, and the bilies join 1 meter down. So at the end is 2.5 with not bilies, but just 1.5 with not food. And the mini bypass, we have 2.5 meters with not food, and the foot is down 2.5 meters down to join with the bilies. So that is the difference. A little more larger pouch. Actually, the bariatric surgeons like more the revisions, the sleeve to convert to other mini bypass, because we know it's a little more malabsorptive, and it's a little more way lost successful rates, a little more than the revisions of bypass, the full bypass. So I hope you had the correct and understand. Dr. B, my husband Sergio and I are having seal surgery with you. Okay, yes, I saw it. I saw the schedule. I see you here. Do a good pre-op diet to get these seals without problems. Okay. If I have 35 BMI with not health conditions, complications, heartburn, heart problems, what can I expect as pre-op diet? Ron shows the pre-op diet weeks. We will see it again. The pre-op diet time depends of your BMI. It's simple. The BMI less than 32 is just 2 days. 33 to 39 is 1 week. 40 to 45 is 2 weeks. 45 to 49 is 3 weeks. More than 50 to 60 is 6 weeks, and more than 60, 8 weeks. Of course, this helps a lot in your recovery time, in your surgery. Your liver, it will be small, less incisions, faster recovery. Remember, it's part of the successful surgery, about pain, about your recovery time. It's your pre-op diet. If you do a very good pre-op diet, even we can do the seals procedures and 3 incisions procedures, because your liver, it will be very small. And your intestine, it will be not inflamed and with not this distension. You will be loosey. So please do the good pre-op diet when you be ready to get the surgery. Can Dr. B repair my husband's abdominal hernia during the sleeve surgery? It was a mesh repair that needs revisions. It's not the ideal time to do the same procedure. We need we can do a umbilical hernia, small umbilical hernias in the same procedure, but when involved a mesh, we can't contaminate the mesh with the intestine surgery, gastric surgery, because we cut the stomach or we cut the intestine, and it's inevitable to get a little contamination in the surgery, but the body, it's not a problem, because we will give you antibiotic, we will give you all the, of course, and we clean out if in case we have a little discharge, but the mesh could trap these bacteriums from your stomach or from your intestine, and could be an chronic infection in the mesh in case the mesh be contaminated by these normal bacteria. So is the reason it's not the ideal time to do a revision with a mesh, okay? Need to be in different time. What are the issues that could arise to make a surgeon not perform the surgery? Okay, in case we find something wrong in your EKG, because when you be here before surgery, we do EKG or lab test and lab test. If we see something is wrong in your lab test, like your hemoglobin is too low, or if we discover in your EKG you have a abnormal sign of you know, tachycardia or a blockage or something, we will need first to fix that, give you iron by 2-3 months, or you need to see your cardiologist to control your high pressure, for example, in case you never known you had this problem and you be here and we discovered these problems, well, that is not possible to get the surgery. It's not common, but could happen. And it's better if you know you had in the past anemia or you have hypertension, even if you are taking medications, it's better if you take the precaution to with your primary doctor to check you before you come and be sure you are under good control in your glucose, in your pressure, in your anemia, because if not, we could have a surprises here and suspend the surgery. Okay, all in my stomach from my nutrition. The rest of me is normal. Could you cut out a lot of my stomach to make small again with one incision sleeve surgery? For how much? Well, no, with that weight, we can't do a single incision. The single incision is for patients who has 30-35 BMI. If you do a very good pre-op diet, your liver is small, you don't have a hiatal hernia. But if you have more than that BMI, the most probability it will be need 4 incisions with a big liver or hiatal hernia. If you did a very good pre-op diet, even if you have 50 BMI, if you did a very good pre-op diet, we have patients, we had in the past patients who has 50 BMI and we did just 3 incisions because they did a very good pre-op diet. So we can't promise you will have for sure the seals if you have a 50 BMI, but we can do 3 incisions maybe. But it's not the cost. It depends how big or not and how dangerous is for you. If we try to do the seals, if you have a big liver, well, it's a little more risk. So it's not the cost, it's just if you are a candidate to do that surgery. Okay, do you remove the stomach that you cut off? Yes, we remove the stomach out of you. Actually, we took picture for everyone and we show the pictures if the patient wants the patient wants to see the pictures. If not, it's fine, but I have my own gallery for everyone. In the future, if you decide to see the pictures, we have the pictures. But we try to show the picture in the same hospitalization if you want to see it. I am currently in the process of filling out my finance application. How much should I ask for if I am approved? That is question for the company.
Right. We need to see your exact, BMI, everything else to determine, but I will have somebody reach out to you hopefully by end of the day.
Okay, the next question is, I have an umbilical hernia. That okay? Yes, is that okay? We don't use the belly button in the regular sleep, just in seals. If you have a umbilical hernia and is small, we can use the belly button if you decide to fix the hernia in the same surgery. If not, nothing happened. You can have surgery. I live in Canada and my flights home all live at 40. I saw on your
Yeah, so basically, anything after 1 p.m. departure, you should be good. The reason we said like 2, that gives us so much time to bring you across the border. But I believe in 1:40 departure is good.
okay. Can I get a note so I can apply for medical leave to recover?
Yeah, so that's a one plus that you get with us is we do help you with the FMLA paperwork for time off from your work, all that we take care of it. So that's another service we provide in our packages.
Okay. What is the complication rate for the standard gastric sleeve? Actually, close to zero. Close to zero. I can't remember any complication. Actually, in the past year, we didn't have any with the sleeve surgery. That is so good because it was more for just hernia, but it was not a big complication. Just the very reparable complications, not in like big risk in the health, but with the sleep, particularly with me, I had not any complication in the last year, so it's close to zero. It's close to zero. It's very safety, that surgery. Why is there a higher risk of with gastric bypass? Well, the ulcers in the gastric bypass, there are from patients who are smoking, the patients who are abusing of the ibuprofen, steroids, that kind of medications, or a lot medications, or if the patient are taking a lot alcohol, and yes, it's a little more risk to get ulcers because you go do a good follow-up in our instructions about the any surgery, not just bypass. But in bypass, we are having this union gastric with the intestine. So it's a little more risky to get ulcers in that part if you don't follow up the instructions. Okay, but it's particularly in patients who smoke. Is it true that the stomach grows in gastric bypass if food not control? The stomach don't, is not replicating their cells. It's just a little stretching. If you push food and food and food into intake more and more, you can stretch the stomach. And even if you could stretch the small bowel too. So even in sleep and bypass, we need to follow rules to take the small portions all the time to repeat, get long-term successful condition your tool. Also, since the stomach will be reduced, vitamins must be taken. But what happens if vitamins are not available or not produced or not relieved at some period of time, months or year after the surgery? In the sleep, the first 2 years is where you need to take the vitamins protein. After that time, you will take the protein from the food. If you are having a healthy diet, you will absorbing your protein vitamins. And just like any patient and any person, you need to check your levels, normal levels or hemoglobin every year in your B12 to check if you are taking enough from the food. If not, you go take an extra iron sometimes. But with the bypass or the malabsorption surgeries, you need to be sure you are getting these lab controls every 6 months in the first years, every one year, or every 6 months in case you are seeing you have a low levels of these hemoglobin, vitamins, and proteins, and be sure you are taking enough medications, absorbing from the food, from your supplements, and the supplements could be IV in case you need a rapid absorbing from your body, or continue with oral way if you are have a normal levels all the time. Okay. What are the statistics of complication during the surgery? Statistic, I suppose. The statistic is low, very low. Actually, in the surgery, we are sure all the time our surgery is perfect, and our surgery is good with good technique. Any chance to get bleeding, with any chance to get any obstruction in the surgery, we are sure we do everything good. So during the surgery, it's very uncommon, the complication, very uncommon. No, don't, you need to be, you need to know we take all the, of course, the precautions, and until we perfectly sure you are with the perfect surgery, we finish the surgery. I can't remember any big complication in the surgery, like any, basal who bleeding and we put a staples in. That's it. That is a not complication, is part of the surgery, but no, not a big. What else? Hello, I do have a question. I have BMI of 33. I have heard we'll be able to consider the bypass. Yes. Actually, we are doing the bypass not just for bariatrics. The bypass, it's anti-reflux surgery. Many years, the surgeons did the bypass just for acid reflux, not for weight loss. So be sure the bypass is the best option if you have a overweight and acid reflux. Okay, the best procedure for a vegan, it's a sleeve surgery. We just change the amount, but the absorption is the same. Okay, so because the vegan is not eating enough meat, where is the main B12, this iron. It's if we add the malabsorption, could increase the malnutrition or low levels that area. So the best option is the sleep. Is the price or will it change based on the patient? Yes, it will change based on the patient. It depends your BMI, if it's a revision, if you have hiatal hernia, or yeah. Which procedure is Antonio? Which option is best for me? It depends. We will check your health questionnaire and then we will see if the option you choose is correct or not, or we will recommend the best for you. Where do we go to have our sutures? We use dissolvable sutures, so you just need to wait 2-3 weeks to see your suture is disappeared. Okay, I have a spinal cord stimulator. Will that prevent me from having the surgery? I know, really, I don't know what kind of device is that. So maybe I didn't understand the question. What is the fee if you have had cesarean? Nothing, not extra in cesarean. My gastro doctor said I have a very small hiatal hernia that was too small to operate on. What are my options? If you have a small hernia, we need to fix it, even if it's in. If you have acid reflux, symptomatic acid reflux, the best option is the bypass. If you don't have acid reflux, symptomatic acid reflux, and you don't have any esophagitis, your endoscopy is, your esophagitis is clear, is good, you can have any procedure with the hernia repair. I had a gastric bypass surgery back in Puerto Rico, 2008. I'm looking for a revision. It's true that the gastric bypass can be converted in something more restrictive. How successful this can be. We, in the revisions, we go into the cavity to see what surgery you had, what we can do. And we have different options to revision in the bypass. The first one is the pouch. If we see the pouch is too stretched, we can redo the pouch. We can do smaller, so you will have a little more restriction. And we go down in the length. We go to the intestine to see how much they jump with not food. So if we see it's not enough to give you this weight loss, we do a little more malabsorptive your surgery. So it depends what you have. 3 times cancer patients due to accelerated estrogen in my body, due to excessive with this. I don't want more cancer in my life. Well, I understand, and actually the surgery, it's known today that decrease the risk of cancer. So yes, if you are with weight, with obesity, you need to get the surgery to down this extra risk you have because you are having this problem in the past. Did you have any availability before month? Yeah, you can see with the coordinator to check the schedule. Are there any long-term or short-term complications with having vertical sleeve surgery? The most, and it's not a complication, it's an issue. If you want to call complication, it's an acid reflux. So in the bariatric world, the doctors don't have a real consensus. Some, the opinion is to, in patients, resolve the reflux when it's not having hiatal hernia or any problem with the sphincter in the hiatus, because they say the heavy food and the quantity of food are given in the patients this acid reflux. And some others know, of course, when you have a hiatal hernia, we have this problem after surgery. But I repeat, the surgery need to be considered, depends if you have or not in the past acid reflux. And that is the condition you could have after surgery if you didn't explore that acid reflux before they take the decision to get the surgery. That is the main condition after the gastric sleeve. My doctor sent me to drink vitamin D3. Do I have to suspend it or I can continue to drink? We prefer the patients don't take vitamins before the surgery or any special beverage, because we know some have a little precondition to be like a blood thinner. So it's fine if you suspend and you continue after surgery. Can you work patients who have scleroderma? Yes. Yes, we did patients like scleroderma. If you have high blood pressure and are on medications, can you still have the surgery if your blood pressure is normal? Yes. And you need to continue taking your regular medications. Don't stop the medications any day. Even one day before the surgery, you need to take it. Do you have financing? Well, that's part of the company.
No, we do not have in-house financing. We work with a couple of financing companies, but is not in-house, is on our page, on the financing page. I actually had a slide here, just something we want to make sure that don't apply to too many places at one time, one or two maybe at a time, because every time you apply for a loan, it hits your credit. And since, you know, the interest rate increase and rise, it's been more difficult to get loans. Best thing, you know, if you belong to a credit union or like Bank of America, check with those first. If you already have a relationship with them, they may give you a personal loan easy with good terms and lower interest rates. Otherwise, maybe things like SoFi, Lending Tree, all those things you can check. Dr. Valenzuela. I can't hear you. I don't know if it's me or. Huh. You got muted.
Okay.
Okay.
Can you hear me?
You still okay. This is the one. I need to. Okay, there you go.
Okay, can you hear me?
Yes, we're good now.
I'm sorry. Well, we will continue with the questions. I can see the question.
Okay, so I would like to cover some items before we continue answering these. Maybe we could answer these by email to you guys and communicate with you. So there are like 10 of them left. So let me cover. Okay, so this one here. All right. The way, okay, so make sure I cover it. So this is a huge factor for your peace of mind is the MTI, which is medical tourism insurance. We work exclusively with this company that has been providing medical tourism insurance for years, and we have a deeply discounted coverage that you can opt to purchase. Is only $149, but you get coverage for your travel, you know, interruptions, your surgery, complication, for any things like that, up to a maximum of $25,000. Of course, this is a huge factor. Again, hopefully you won't need it, but it's better to have that insurance and not use it just for peace of mind. And we talked about bariatric vitamins. A couple of things I wanted to mention about the type of surgeries that we offer is like, you know, the because of the expertise that we have among these 7 team of surgeons, we can offer so many different procedures. And every surgeon is great in certain areas, and but overall, we can cover this wide spectrum of services that we offer, from duodenal switch to SADI to gastric balloon to 100 BMI gastric sleeve to maybe 60, 65 BMI gastric bypass. So we're capable of doing a lot of different surgeries, even reversal of a bypass, revision of a bypass with endoscopic way. So, and that's why we have that surgeon liaison sitting in the middle, and we have the distribution of your HQs to the right surgeon for the right procedure. And we're not, so what are the benefits of that? It's huge, because let's say if you had acid reflux and this company that you go to cannot offer a high BMI bypass surgery, you get sleeve, you're not getting the right procedure. And this is a permanent changes to your internal organs that would stay with you forever, and is not the thing that you really need to get, and is going to bother you for the rest of your life. And is worse than plastic surgery, because in plastic surgery, maybe your tummy tuck is not symmetrical, but it won't kill you. So this is what you get with us. Is like you are getting the best procedure that is suitable for you. And when you go to Mexico, you still have a chance to talk to the surgeon that you're getting surgery with, and make sure that is the right procedure for you. So saying that we are not forcing COVID testing. We recommend you do COVID testing for yourself and your companion before you come. Make sure you're clear. Again, use mask, use, as much as caution you can when you're traveling, and then when you're going back. Okay, I think Dr. Valenzuela, we gotta have to, because we almost at the 2-hour mark, to do the raffle and try to answer the rest of the questions. Maybe email them or go through the coordinators. So I have all the names that are eligible, and they did the HQ. Again, the winner would get the surgeries only with Dr. Valenzuela for the procedures that Dr. Valenzuela offers. So I'm going to pull one name here. Let's see who is the winner of our raffle today. Christina Alvarez. Christina Alvarez. I'm going to try to let you talk to us. Okay, Christina.
Congratulations.
Yes, congratulations. Are you still there, Christina? I'll let you talk. You can unmute yourself and share your story with us and tell us more about yourself, where you're coming from, and more, please.
Okay, hello. Can you hear me?
Yes, yes. Hi, Christina.
Oh my gosh, I cannot believe thank you. I wasn't expecting that at all. I just really wanted to know what was going on. I've struggled with weight my whole life. I've been on and off diets and on and off diet pills and medications, and I'm not I've never been like diabetic enough to qualify for certain medications. I've never been with high cholesterol or sick enough, I guess, if you will, to qualify for any type of medical, but I'm always been 50, 60 BMI. And holy cow, I don't even know what to say. I was struggling with doing this versus other options, and I want to get the gastric sleeve because I think it's the best for malabsorption and what's going on with me, and I'm blown away. Thank you so much.
And which city do you reside?
I live in Washington.
Washington, okay.
Yeah, in Washington, Tacoma.
Okay, great.
Perfect.
So, yeah, so we look forward getting you on our calendar and get you down there and meet you. And Yeah, so we will have a coordinator contact you. Again, thank you so much, Dr. V, for attending, taking time with us. Thank you, everyone, to attend. We appreciate all your support and have a great day and have a great journey. Thank you. Goodbye.
Thank you. Good day.